All right, I think we're live, guys. Hey, everybody. Thank you so much for joining us once again here at the official launch day party for Thyroid Refresh. Woohoo! We're
Woohoo!
so excited to announce to you that we have just gone live with our site, thyroidrefresh.com. So if you haven't already, be sure and stop by. Danna and I are the co-founders of Thyroid Refresh. And we are here with Mary Shomon, who we are so lucky to have here with us today. Hi, Mary.
Hey, how are you?
We're great. Mary has been on this journey with us since pretty much the get-go. She is our resident thyroid expert for Thyroid Refresh. She's a New York Times best-selling author. She's written over a dozen books on health and thyroid health, and she really knows her stuff. And not only that, she is one of the biggest advocates for thyroid health out there. So we are so grateful to have you on the team with us.
Thank you. I'm excited to be part of such an amazing new platform and service for the thyroid community. So I'm thrilled.
We are grateful too. I woke up with a very full and happy heart. I wasn't really nervous, but I had butterflies. Huh? That's so apropos.
Yay. Absolutely.
Totally. So this is Ask an Expert. You guys, please, in the comments, please share any and every question you have for Mary. She's going to be, we're going to start out chatting about some, thyroid health tips, just general kind of stuff. And then we'll open it up at the end for a Q&A. So while you're listening, please submit your questions.
And also, if you think there's someone out there that this might resonate with, we'd love for you to share it with them, and also click the notifications so you're going to be in tune and up to date when we go live for the next two.
Before we get started, I just want to give people a little bit of information about Thyroid Refresh in case you're not familiar. This is something that really we don't see has been done yet out there. And this is something that's created by thyroid patients for thyroid patients to empower you and help you adopt and live a thyroid healthy lifestyle so that you can thrive. You could think of it as we call it a living thyroid lifestyle magazine, but there's so much more interactivity than what a print magazine could give you. So there's some real magic that happens when you become a Thyroid Refresh member and join part of our community, where it isn't just content. This is totally interactive. There's built-in support. We deliver to you guys on a silver platter all the tools that you need to succeed so that you can thrive. So thyroidrefresh.com. If you're not interested in becoming a member, don't let that stop you. There is loads of free content for you guys to browse. So make sure you stop by and check it out. So let's get started with Mary. Mary, we did this survey a while back when we got started, and I think we had about 1,600 responses. And one of the questions we asked people is, what is your biggest roadblock to, getting to a more optimal state of health? And the number one answer, this is heartbreaking, is that most of the respondents said that they were too tired and sick to do anything. They were hopeless, they're stuck, they're unhappy, and they just really feel so awful. Their health is so poor that they're really unable to function. So what's your message for those people who say, I've tried everything and nothing has worked and I'm just ready to, throw in the towel on trying?
Well, my first message is that you can never give up. There is always the potential for healing. And so we never, ever want to completely abandon all hope. We may not be able to cure a thyroid issue if you are missing a thyroid gland through surgery or atrophy with Hashimoto's, for example. You're not going to be able to regrow a missing thyroid, but that doesn't mean you're not going to be able to be healed and to live a full, happy, healthy life, doing everything possible, including all of these amazing lifestyle things that we are talking about here at Thyroid Refresh. But you've got to have energy to tackle the doctors, the medical system, and to make lifestyle changes. Everybody has good intentions, but if we're on the couch exhausted how are we going to get up and make sure we're getting some exercise or cooking amazing things for ourselves and our families? So we need energy. And so step one for every thyroid patient is a little quiz that I'm going to give you all. So I want you all to participate with me out there watching today. If you are tired on a regular basis, I want you to raise your hand. So Ginny and Danna, please join in. So everybody who's tired, raise your hand. Now, keep your hand up. Those of you who are getting 8 hours of sleep a night, I want you to keep your hands up.
I did last night.
All right. Well, Ginny's
not every night.
Right? Sometimes. Okay.
It's hard. Yes, it is hard.
It is. It's very hard.
Yeah.
But one of the things I say to people is we can do everything right. We can take the right meds, eat the right foods, hydrate, relax, reduce stress, do everything possible. But if we're not getting that foundation of sleep, and sleep time is the time when we are building our hormones. It's when the hormone factory goes into business. And so if we're not getting that 8 hours of sleep a night, we really shouldn't be complaining about being exhausted. So that's step number one, is working towards getting that 8 hours. Now, if you're a 4 or 5 hour a night person, you're not going to be able to start sleeping 8 hours tomorrow, but you can start adding 15 minutes, go to bed a little earlier, practice good sleep hygiene, and bring in things like melatonin, magnesium, meditations, relaxation approaches, hot baths. There's a lot of different things we can be doing to make sure that we're getting better quality sleep and slowly increasing the amount of sleep we get every night. That is so foundational for anyone from a health standpoint, and in particular for thyroid patients who often need more than the 7 to 9 hours a night. That is the average for someone who's perfectly healthy with no autoimmune or endocrine or metabolic problem.
And I do get, sleep. I just don't get uninterrupted sleep. So that's what I'm working on. It's not easy. So that's some advice that you don't have to go to your doctor to get. You can get right here from the thyroid expert herself, Mary. Work on your sleep. It's really that important.
It absolutely is. In fact, some doctors like Dr. Jacob Teitelbaum, who's one of our favorites out there, is an expert on hormones and fatigue-related illnesses, said it is actually more important to get sleep than almost anything else that you do. And he often has his patients taking 3 or 4 different supplements, and in some cases even medications to aid in sleep, because he said it is so fundamental and so crucial that whatever side effects or risks there are associated with low doses of sleep meds may be worth the trade-off from getting good quality, uninterrupted, refreshing sleep 7 to 9 hours a night. So it's something to think about.
And it's something to talk to your doctor about for sure.
Absolutely.
Yeah. And Mary has written for us pretty extensively about, not only sleep, but really the core tenets of thyroid health, things you can do, lifestyle, how to thrive, how to get out of this place of I'm too tired and sick to do anything. So if you go to thyroidrefresh.com and go to the blog, you can browse categories. A lot of Mary's writing is available in the thyroid basics category. This is like our core content. It's a really good place to start if you're new to Thyroid Refresh or if you're newly diagnosed. So she's done an amazing job with these articles. We're so happy to have them. What else can people do? Can we talk a little bit maybe about food?
Well, with food, there are a couple things that we can do. First of all, there is a nutrient that is not easy to get from food that we want to make sure that we're getting enough of, and that is vitamin B1, also known as thiamine. And there are a number of studies that have shown that within hours, and in some cases within 2 to 3 days, you can reverse about 75% of Hashimoto's and thyroid-related fatigue if you supplement with 650 milligrams a day of vitamin B1 thiamine. And vitamin B1 is a safe, effective vitamin. It doesn't have a lot of contraindications or reactivity with anything. Of course, you always want to check with your doctor or your healthcare provider to make sure that you're doing the right thing when you're adding supplements. But this is a very safe supplement, and I am getting so much feedback from my readers and the community on the effectiveness. Some people are saying within 2 days, they felt 50% better. And within a week or two, they felt almost back to normal. energetically. And of course, this is assuming that they're already treating their thyroid issue. They're doing what they need to be doing when it comes to medication, if that's something that's called for as part of their treatment. But vitamin B1, number one nutritional recommendation that I have. And then, of course,
I was going to say, one of our expert friends and gurus out there, Isabella Wentz, she's got a great article on it. She really says the same thing. I mean, thiamine, it's a game changer for me. It really is. Definitely.
Yeah. It's absolutely amazing. And then there's D-ribose supplementation, which is great for energy. Again, another amino acid that's hard to get from your diet. And so you can supplement with D-ribose, and you can supplement with a little tyrosine. So these are helpful. Again, all these nutrients are difficult to get from your diet. And then, of course, from a dietary change standpoint, anything we can do to reduce inflammation or reactivity. So going gluten-free is important for many people, making sure that we are not overdoing it with sugar, and lower glycemic eating, keeping our blood sugar more stable, helps with fatigue and energy. And also eliminating foods that we're allergic to. A lot of times people will say, oh, I feel so much better when I'm not eating dairy. And then I'll say, well, are you still eating dairy? Yeah. Why? If you know that you're feeling great when you eliminate a particular food item, unless it's something that's absolutely essential, and almost always we can get what we need from an alternate food source, cut out those things that you feel better when you've eliminated, and stick with it, because your body's going to thank you. That inflammation causes fatigue in the muscles, the brain, the heart, the joints, causes pain, and it can cause weight gain and additional issues with your digestion. So those are a couple of very basic things that I think are important from a nutritional standpoint to keep your blood sugar stabilized, avoid things that cause inflammation. And of course, one of the core tenets of Thyroid Refresh is stay hydrated. We need enough water in order for our hormone production process to work and for our metabolism to function well.
Okay, I will.
There she goes. And it's purple. I love it.
Yep, purple power. This is such great information, you guys. And again, we want to invite you to, if you have questions, put them in the comments for Mary. We're going to open this up for a Q&A at the end of our time here. So make sure you take advantage of this opportunity. You've got Mary Shomon right here with us, right here, right now. Ask her anything. Thank you so much for bringing up those points about, nutrition. I know for me, diet has been huge. It has helped me lower my antibodies substantially by half, things I didn't know that I was sensitive to. And I know it's hard for people, people really butt up against that. I don't want to give things up. I did. I was a chef. All I thought about with food is how to make it taste good. But when you're not feeling well and then you discover those dietary triggers, it's so empowering. And when I started this process, I remember my husband would say, oh, I'm sorry, we're eating ice cream in front of you or something. And I would say, don't feel sorry for me. I'm getting my life back. This is empowering. I feel better. I'm okay with it because I was able to make those cause and effect correlations with food. It's huge.
Right.
Yeah.
Well, they say, there's that old saying about nothing tastes as good as thin feels. And I think it's nothing tastes as good as well.
Healthy.
That's right. I love it. Oh my gosh.
Yeah.
That's awesome. So true.
I was just going to say really quickly for me, nutrition, it's huge. And, when you're not getting all the nutrients that you need, even when you're eating well, that's even more frustrating. So I've gone to the doctor and I've got my supplements and I'm eating well. And I can tell the difference, like if I add in the occasional dairy or something like that, I can always tell. And don't feel like you have to. I wanted to say this a moment ago when you were talking, Mary, when you think of elimination or that kind of thing, you think I'm never going to be able to eat ice cream again. You really shouldn't just eat ice cream all the time. But once you do this and you get yourself to a more a place in your life, then you absolutely can have the occasional this or the occasional that. So it's not about, forever not being able to have a slice of pizza. Should you have one every day or once a month? I don't know. It depends on you, but you can, it's not about, taking this out forever. So.
Well, and today, there are so many amazing alternative products. I've even before my thyroid went haywire, I was not someone who did well with dairy. I'm somewhat lactose intolerant. So a big bowl of ice cream is just a stomach ache in the making for me. But once I started to get more into healthy eating and looking at gluten-free options and all the different alternatives out there, I also found out that there's some amazing ice cream made with almond milk. And there are some great non-dairy frozen ice pops and things like that. And some of them are actually low sugar and low calorie or low glycemic. And I bet Ginny's going to have some cool recipes for us coming up in the summer for some treats and things that are healthy alternatives to the things that we want to eat. The less processed we can go, the better off we are. I mean, I've seen people that just took a piece of fruit, put it in the blender, added a little bit of juice and put it into the freezer and made sort of an Italian ice. And there's lots of different ways that we can get the textures, the flavors, the amazing things that we want with whole food, with natural products, and not necessarily reaching for something that's in a box or a can on the shelf.
So we've talked about different inputs like sleep and supplements and food. What about medication?
Well, medication is always going to be an issue for a population of our community here, because we have people that have been in a situation where they've lost their thyroid due to surgery, or they've had it radioactively ablated for Graves' disease, or as part of a cancer or goiter nodules treatment, or in some cases Hashimoto's has progressed to such an extent that the thyroid has atrophied. And we have to have thyroid hormone to survive. It's absolutely essential for everyone on the planet to have enough thyroid hormone in order to survive. It's not optional. But the issue is making sure that we're getting the right hormone and the right medication in the right combination at the right time of day that is safe and most effective for us. And that's one of the empowerment issues for the thyroid community, because we want people to know that what is presented as the standard treatment, and in some cases the only option, which is a levothyroxine drug for thyroid replacement, for example, Synthroid or Levoxyl, is only one of a number of different options and combinations and brands. Because, for example, some people don't do as well on Synthroid, but they do beautifully on Tirosint, which is the hypoallergenic liquid form that is so much better absorbed, because it bypasses issues for people with absorption and allergies and food problems and stomach issues. And a lot of thyroid patients have gut problems, dysbiosis issues, microbiome problems. So even something as simple as switching brands to a different format can make all the difference in the world. And I know we've got some people that are on watching today, because I have a few folks that I know that said they were going to be joining in, that have found out just that. They completely transformed their situation by switching from Synthroid to Tirosint, or in some cases adding a little bit of T3, the active thyroid hormone at the cellular level, can make all the difference in the world, from dragging yourself around at half speed all the time to feeling like you're at least evening the playing field. I mean, none of these things are going to immediately restore you to pre-thyroid energy, weight, and everything else without extra work and effort. But it doesn't put you behind the game. You're not in a situation where you're going to be eating 800 calories a day and working out 5 times a week and still gaining weight, or you're sleeping 12 hours a night and waking up still exhausted every morning. We want to make sure that we get the benefit of the sleep, get the benefit of the nutrition that we're eating, and get the benefit of the exercise and diet and other healthy approaches. If we don't have that foundation of the house built, there's no point in putting pictures on the wall. So we've got to get that thyroid sorted out and handled. And of course, that is for the people that have substantial thyroid issues. Some people have very borderline issues. They can sometimes be managed with medication, with diet, with supplementation, with diet, with lifestyle changes to get them nudged over the edge into the normal range, and they feel well. But we want to make sure that everybody understands that if you need medication, there are some situations where you may be able to go off of it, but for the majority of us, we're going to need to take it, but we want to do it in a in a way that we recognize that this is something that our body needs, and it is just part of the overall picture, along with all these other wonderful things that we're talking about as far as our lifestyle.
And it can change too. That's another important part. Let's say you're taking, 1 grain of Nature Throid or whatever it is, you
Right.
kind of have to pay attention and listen to your body. That's all about, that's what we're all about, your lifestyle and paying attention to your body.
Absolutely.
It may change, you may not need as much, or you may need more. You never know. It's going to be ongoing.
Well, especially for us women, because you girls are younger than me, but as we go through the perimenopausal transition in our 40s and into our 50s and menopause, it's buckle your seatbelts, ladies, because the hormones are up and down and all around, and the thyroid function and the thyroid needs can change. And this also applies for those who are younger than us, who are getting pregnant and having babies and just delivering babies and breastfeeding. These are all times when the thyroid needs change drastically and dramatically. And in fact, it's crucial to having a healthy pregnancy and a healthy baby to make sure your thyroid is managed very carefully. So these are all times when the thyroid function can change. So it needs to be a lifelong a process of adaptation and adjustment so that we can keep it functioning in tip-top shape.
It's a lifestyle.
It is. Yeah, absolutely.
It really is. We're going to be opening this up to some Q&A with Mary Shomon. So if you haven't already, please add your questions to the comments now, guys. We're going to be moving right along to that. I just wanted to ask you one more quick question, though, before we get to our Q&A. One of the things we get asked about a lot is, well, what if I don't have hypothyroidism or Hashimoto's? Because so much of the content seems like steered towards that. Can you sort of speak to that question for people?
Sure. Well, there's two ways that I would look at it. First of all, one of the realities of thyroid disease is that from the standpoint of conventional treatments, almost all roads lead to hypothyroidism. So if you have thyroid cancer, almost always they're going to take your thyroid out. You're going to have a thyroid surgery or thyroidectomy, which leaves you hypothyroid. You may have had thyroid cancer, but once your thyroid is gone, you're hypothyroid and need thyroid replacement. When you've had Graves' disease, if you're on if you get radioactive iodine treatment for your thyroid, you're going to end up most of the time hypothyroid. So in many cases, all roads lead to an underactive thyroid. Most of the treatments are designed to make you underactive or to remove the gland that's filled with cancer or nodules or is enlarged in a goiter. So that's why I think the information tends to skew more towards hypothyroidism in general. And it's also the much broadest category of people, because we estimate maybe 60 million people out there in the United States alone have a thyroid issue. The vast majority of it is hypothyroidism. But the other issue is that when we're talking about thyroid, is all the things that we're talking about doing here are good for whatever is going on with your thyroid. So if your thyroid is overactive or underactive, if you have autoimmune or your thyroid is just gone slow for reasons related to medication you're taking or lifestyle or stress or adrenals or iodine deficiency or any one of the number of reasons that are affecting thyroid issues, causing everything from goiter to cancer to nodules to Hashimoto's to garden variety hypothyroidism, for lack of a better word. All of these things that we're talking about doing are going to help us have a healthier, better energy, better health, better wellness, and overall better quality of life. So I don't care what is going on with your thyroid, you need to be getting that sleep, that nutrition, the hydration. You need to be managing your stress. And these are all good things. They're not only good for thyroid, but they're good for overall wellness. So these are foundational skills, foundational items to focus on that are going to help us build wellness out across all of the facets of our body. It's not just thyroid specific. We're focusing in on some really great thyroid related things, but this is going to have benefits that cross over into every aspect of your life.
One of the things you said the other day when we were, preparing for this is you don't have to have a thyroid to do a thyroid refresh.
Exactly. Exactly. And that's true. You really don't, because everybody needs a thyroid refresh. And frankly, I'm hoping that we even have people who don't have a thyroid problem doing a thyroid refresh.
Me too.
Absolutely. Preventive
Everything that we're doing is good, healthy, basic information that is so empowering for our overall health. So I want people to grab grandma, grab your daughters, grab your friends, grab everybody you know, and get them in on this thyroid refresh, because all of the principles and all of the things that we're tracking and learning about are wonderful things. I want my 20-year-old daughter, who doesn't have a thyroid problem and hopefully never will, to do a thyroid refresh right along with me.
Yep.
Well, we've got some incredible questions coming in.
We
should
do.
we get going on those?
Yeah. I mean,
Okay.
a lot of these things we've talked about, but it'll be nice to kind of mention them again and as a recap. And some of them we haven't touched on yet. Nancy Caputo, I'm frustrated because my lab results show I'm in the normal range with 45 milligrams Armour thyroid. My doc says I'm fine, but I know I'm not.
Okay, well, Nancy, that's as standard and common a question as I've heard for 20 years. I've heard people complaining about the same exact situation. And the question there is, there's Leslie Blumenberg is a thyroid advocate, and she coined the phrase, normal is a setting on the dryer. And I love that because it's true. What is normal in the standard of a lab test is not necessarily what's normal for you. So what we want to look at is whether or not you're normal, but whether you're optimal and optimal for you. And for most of us, we know that optimal means the lower end of the TSH range and the higher end of the range for the free T4 and free T3. So you want to know those numbers, TSH, free T4, free T3, and you want to make sure that they are optimal and not just normal. And I think we have a great article on Thyroid Refresh in the blog area talking about how to sort of manage your overall treatment process, because in some cases people need additional T3 or they need to time release their medicine, and they need adjustments in the dosage to get to that optimal sweet spot. And even when you get to that point, there may still be things you can do. Like we're saying, eliminating gluten or changing up your diet, getting hydrated. In some cases, I talked with someone the other day who spent 20 years exhausted and found out that they were dehydrated, started drinking 20 ounces of water 5-6 times a day, and said, my fatigue went away within 2 or 3 days. So these are some things that, in addition to making sure that medication is good, may be able to help bring in the entire picture and help us feel well. But Nancy, we need to get you to look at what's optimal for you, find out those numbers, compare them to where the optimal numbers are, and get back into the doctor and start advocating for some changes to your treatment program.
Okay, the next one from Andrea Davis. I know that you can speak to this one. Basically, all she says is hair loss. But I know this is a topic for you, and you've written a book or two with Brent. So I want you to talk about hair loss because it's a big thing.
Absolutely. And, hair is a visible sign of our health, of our youth. And as women, I do not think that there's any shame in being vain about your hair. I mean, you've got to go out all the time with this. And it's very frustrating to see your hair completely falling apart. And I know I went through this about 15 years ago. I lost 80% of my hair. My hair, and I've got a lot of hair, for a woman in her 50s, I've got pretty good amount of hair. You could take all of my hair at that point when I'd lost and put it in a ponytail, and it was about the thickness of a pencil. This is about how much hair I had left. I wore my hair in a bumble with a piece of fake hair on top of it because I didn't know what else to do. And it turns out that there are a number of factors to keep in mind when it relates to hair. And I've put this together in the book that I co-wrote with hair guru extraordinaire, Brent Hargrave, who is an expert on hair loss. He's a stylist who is just fantastic. But the bottom line is a couple of things. Number one, we need to make sure that the thyroid is handled properly. And that obviously that optimal thyroid levels that we were talking about for Nancy's question come into play. But we also need to keep in mind that people who are on levothyroxine drugs like Synthroid alone may have some hair loss from that. So some people find switching over to natural thyroid drugs like Natrethroid or Armour may help relieve the hair loss. Another thing that we absolutely need to do is we need to check ferritin levels. Ferritin is the stored form of iron, and it is absolutely essential for functioning of your hormones and for hair. And so if that ferritin is low, and low is a relative term here. A lot of labs in the United States test ferritin and they run a range from about 20 to 100. If your level is 25, your doctor might say, oh, your ferritin was fine, your iron is fine. Not so. A lot of docs that I've talked to out there in the holistic and integrative world want that ferritin to be at 80 out of 100. So we want to see it in the top 20th percentile of whatever the reference range is at your lab. If it's not, we need to supplement with iron. But warning here, 3 to 4 hours apart from your thyroid medicine, so it doesn't interfere with your thyroid medication. Iron can be a little tough on the stomach. So one of the things that I always suggest, and I know a lot of doctors that I love also do, is Floridex, which is a form of iron that is gentler on the stomach. It's less likely to cause stomach upset or constipation. Comes in a liquid form. You can get it at health food stores. It's a great form of iron. But again, 3 to 4 hours apart from your thyroid meds, and get rechecked and keep supplementing with iron until you get that ferritin up to a point where it is robust. But keep in mind with hair, you're going to have to be patient because hair grows in slow cycles. So what I'm doing now for my hair isn't going to be reflected for probably 4 to 6 months. So watch for little baby hairs up on your hairline sprouting out. That's a good sign. Watch for when you go in the shower and not having to use a bottle of Drano after every shower to unclog the drain, which is something I went through. I thought I was going to stuff pillows with all the hair coming out of my head. And I know people that have complained. They said, I'm going to go bald. And I can tell you most of the time, you're not going to go bald. You might get thinner and it may be a little bit frustrating for a while, but you won't go bald and you will eventually figure out how to get your hair back. I did. And in the meantime, you can talk to people like Brent and learn a little bit more about approaches, because Brent has some great tape-in hair extensions that are gentle and safe for your hair, and some products that thicken your hair and make it look fuller. So you can fake it till you make it. So there's ways to do it. We don't have to go around with a big bald, crown showing through when our hair is thinning, or we don't have to be putting a hat on and hiding for the next 6 months. There's ways to make it work. But get that thyroid sorted first of all, and get the ferritin checked as step number 2 as your basic foundational things to do. And
magnesium as well?
Magnesium is helpful, but when it comes to hair, we're also looking at the B vitamins like biotin. And one of the best products that I love, there's a hair vitamin called Cooper Complete Dermatologic Formula, and it's fantastic for hair. It's got biotin and a variety of B vitamins in it. Also collagen products.
Collagen.
I know we're going to be talking about those here at the site. The collagen products help with hair and nail and skin turnover. So those can also help as well. But that ferritin level is critical. The other thing is just to keep in mind is protein in the diet, because I've talked with some women who started to have some really significant hair loss when they went vegetarian or vegan, and they started to eliminate protein out of their diet. And not all of us are meant to be vegetarians or vegans. And for some of those people, that switching back to including some grass-fed beef or buffalo or lamb a couple times a week was the difference, because those are very iron-rich meats, and they seem to help potentiate the iron use in the body and help with the ferritin levels.
We are at about 30 minutes. Mary, are you up for maybe taking a few more questions?
Absolutely.
Okay. Amy Talby Bruce asks, I am a nursing mother. Could that throw my thyroid levels off?
Nursing mother, absolutely. Pregnancy is very strenuous for the thyroid, because for the first trimester, our thyroid has to provide thyroid hormone for mom and baby. And then as the baby starts to develop, we are handling so many different facets of the baby's development in our body, and the strain on the thyroid continues up through pregnancy, through delivery. And then after delivery, of course, we have a precipitous drop in both estrogen and progesterone, which can throw the thyroid off further. And then during breastfeeding and nursing, we also have an additional strain on the thyroid. So it's a time when autoimmune thyroid often shows up, postpartum thyroiditis, which is a temporary form of a thyroid imbalance that can show up. So there's a lot of thyroid issues that can appear after childbirth. And in some cases, it's hard to identify them because these are going to sound familiar to any new mother. My hair's falling out. I'm tired. I can't lose the weight. I don't have enough milk for my baby. I'm feeling depressed. I can't sleep well, or I've lost a lot of weight really fast and I don't understand. My body's just changing very dramatically. Mood swings, anxiety, all of these symptoms can be signs of a postpartum thyroid problem, but they're also very common signs of a new mother. So it's really important, I think, for any woman who's having issues with depression, with weight that is just not budging at all, with extreme fatigue. And here we're talking not normal new mom fatigue, which is pretty intense, but the kind where you just can't keep your eyes open, any breastfeeding difficulties. These are all signs that you need to get in and get the thyroid completely evaluated, because if it's off during that period, getting it sorted out is going to give you the energy to enjoy that baby more and to really be able to be the mom you want to be.
All right. Thank you so much for that, Mary.
Mm-hmm.
We've got Lisa Rafalco. She wants to know, what is subclinical hypothyroidism and should I be medicated?
Well, subclinical hypothyroidism refers to a form of hypothyroidism that is mild or borderline. And there's really two different ways to define it. The conventional medical world, the endocrinologists out there, define subclinical hypothyroidism as TSH of less than 10 and above 5. And I know some of you are going to go, oh my gosh, because a TSH of 5 or 7 or 9, and I'm going to be flat on the couch, incoherent. So to me, that's not subclinical. That is profoundly hypothyroid. But from the medical definition, it's a level under 10, but not normal. So some doctors actually think that shouldn't be treated, which is insane in my opinion. But that said, other doctors, the integrative doctors, the hormonal experts, the kind of doctors that a lot of us really find the most empowering when it comes to this topic, feel that subclinical hypothyroidism is anytime we are not optimal. So if we are hypothyroid, but the treatment is still leaving us exhausted and fatigued with a TSH on the higher end of the reference range, or the T4 and T3 aren't high enough, then we might be defining that as a subclinical or a borderline hypothyroidism. Now, whether or not to medicate it really depends on your symptoms. If you're feeling great and you're borderline subclinically hypothyroid, then a lot of times people will say, I'm just going to watch it. I'm going to make sure I get enough iodine in my diet and do some other things. But there's some things to keep in mind. Number one is, if you have antibodies, you have Hashimoto's antibodies, but your hypothyroidism is subclinical, it's borderline, you are likely to fail over time. Your thyroid is likely to fail over time. And taking some medication at this point can actually prevent you from progressing to overt hypothyroidism and your antibodies increasing. So there's a preventative benefit for some people in treatment of borderline or subclinical hypo. The other thing is, if you're subclinically hypo and you're thinking about getting pregnant, or you're pregnant, that is not a good scenario. We want to make sure that the thyroid is well controlled and managed before getting pregnant, or as soon as it's detected during pregnancy, because optimally TSH should never be above 2.5 to 3 during pregnancy, and during that first trimester below 2.5. So if your TSH is 4.9 and you're thinking about getting pregnant, you're feeling great, doctor says, well, you're a little borderline, that's a time to really think about the benefit of treatment in terms of your fertility, your ability to maintain the pregnancy, and the health of your baby. All
right. Danna, do you want to pick the last question? I think we've got maybe time for just one more.
Yeah, we do. And it's hard to pick. Okay, so how about from Leslie Johnson? Is there any hope for me after taking the iodine treatment?
Okay, so Leslie, I'm assuming Leslie had the radioactive iodine?
Mm-hmm.
Okay. Well, I guess the question is, what the hope for her after you've had radioactive iodine, which is usually given for hyperthyroidism, typically Graves' disease, that is not resolved with medication, or in some cases they want to go ahead and do the radioactive iodine. Most of the time you end up hypothyroid. Occasionally people have a recurrence of Graves and have to get an additional radioactive iodine treatment, but most of the time they give you enough of a dose that it knocks out your thyroid permanently, makes you hypothyroid. So is there any hope? Absolutely. Look at all of us. We are all hypothyroid, all of us, and all of the folks that are part of Thyroid Refresh have thyroid issues of varying sorts. And we're healthy, we're feeling great, we're working on the things that we want to make better, but we've got the foundations of good health working. Again, it's an issue of making sure that you're combining a good balance between the right medical treatment when it's needed, so optimal thyroid replacement for those of us who have no functioning thyroid, who've been radiated, and all of these other lifestyle issues. It's understanding that the sleep, the stress, the nutrition, and just having fun, all of these things all play an important and essential role in whether we feel well. So I would say absolutely we've got to have hope. And there is hope for you, Leslie. It was Leslie, right?
Yes.
Leslie, there's definitely hope for you because at any age, I don't care whether you're 20 or 80, I have heard from people who said, look, I made a few small changes in my life and it's made all the difference. I've had 80-year-old women who added T3 and went gluten-free and said, I feel like I'm 60 again. So it's never too late to make the changes, and it's never too late to have hope. And don't give up, because you can be healed. And that's what we're talking about here with Thyroid Refresh, is an environment for healing your life and healing your lifestyle and healing your body and your mind and your spirit, because all of it plays a role. And ideally, we're all going to get that together and support each other going forward with this.
That's right. So thyroidrefresh.com, guys, we've just gone live today. And thank you so much for that, Mary. We are so blessed to have you on this journey with us. And thank you, for all the wonderful questions from our audience. We'll be keeping this up on our Facebook page, so you guys will be able to view it at your convenience, or for anyone who wasn't able to make it to the live session. We wanted to quickly announce the third winner from our launch party giveaway. You want to do it?
Yeah.
Okay, go for it.
Okay, so we are going to give away our second gift basket. So excited. It's got all kinds of amazing things in it. I want to keep it. They're over there. I wish I could show you. I set it up all cute and nice, but I can't show you, so I'm sorry. Okay, the winner is Jennifer Knight from Indiana.
All right. Okay, congratulations, Jennifer. Danna used to be a cheerleader, and I come from a long line of cheerleaders myself, so it's hard to get away from that around here.
That's right.
Also, we have a special discount to share with you guys. This is for today only.
Yeah. Just Thrive, thriveprobiotic.com. They are offering us 20% off, which is fantastic. You enter the code thyroid20. So just for today, for people watching, check it out, thriveprobiotic.com. Spore-based, it's amazing.
It really is an amazing product. So thank you so much for being here today with us, Mary. We're so glad you're on the team, and hope all of you join our Thyroid Refresh community and family so that you can be a part of this and get this kind of incredible information and support on a regular basis so that you can feel better too. It is possible. Like Mary said, it's never too late, and you're never too old, and you can feel better. So believe that.
Thanks, everybody.
Bye.
Thanks, Mary, and thank all of you.
Be sure to tune in for Adrienne Klein, our holistic nutritionist. She's going to do a pantry kitchen tour, so it's going to be really fun. Okay, bye, guys. Thank you.